Grace Cottage Hospital was founded in 1949 by Dr. Carlos Otis, who had come here in 1938 and got tired of delivering babies in the back seat of a car on the way to Brattleboro. So he decided to found a hospital, and the opening day was August 8th, 1949, and he delivered the very first baby that night.
I've been at Grace Cottage for 30 years, and we can get together and reminisce about the old times. But it's also wonderful that new faces keep showing up, new people, but they come here for the same reason, that they believe in giving medical care in a small setting, direct, hands-on, rubbing elbows with people you care about, working together as a team, knowing where people come from in the community, their families, how to make them better and how to return them to that setting where they want to live.
People want accessibility to their physician, and they have that here, and they have that in this valley, and they have that with this cadre of doctors. They're very accessible. This little hospital is sort of an innovative little place, and we were the first hospital in Vermont that had swing beds, and we started practicing high-level rehab early on. We were the first place to use thrombolytics and cardiac disease. There's a wonderful EMS service. We have Rescue Inc. on campus. We have very good rescue squads in the local area, most of whom were trained through the hospital system. That's been incredibly useful to the community. You can do a lot of the basic good medical care right here. But if you come in with your acute heart attack, we have dovetailed the system with the cath lab at Dartmouth so that we use exactly the same tubing that they use, exactly the same form that they use, and exactly the same drugs. So they're actually looking at the same EKGs we're looking at. And then they say, okay, this is what we want you to give them, and the helicopter's on its way. And we get door-to-door time in under an hour for a heart attack, which is exactly what you need to get a successful result. Same thing happens with strokes. Major injuries, head injuries, things like that are immediately, airlifted out.
People are always amazed about the amount of technology that we have here. We have electronic health records, we have a 40-slice CAT scan, we have a bone density machine, an ultrasound. They're just amazed that a hospital of this size can be so fully electronic as we are.
We have a wonderful community wellness center, wonderful classes for strengthening bones, for dance, for movement. These are well attended. And again, it's part of that continuum of care.
The reason we came to Grace Cottage was when my 33-year-old daughter was dying, and we had had a history of going to Boston for her whole life for treatment. We felt very, very homey here. We felt very comforted by the smallness and the quietness and just the peace that was here. We could feel it. She liked the comfort of the hospice room itself and the way it was fixed up like a bedroom and not a hospital room. She liked the fact that I could stay right in the next room and be there all day, all night, and just hop away to get to her. And Bethany was so pleased that we found it. And I was pleased because she was happy here. She felt at peace. And she went out the way she wanted to. And you can't be unhappy with that.
When I was in Brattleboro Memorial, where I had my hip repaired recently, I knew that I was going to have to come someplace between the hospital and going back home. And I urged them to please send me here to Grace Cottage because I'd been here before. And it's just a wonderful place. The difference, I think, about Grace Cottage is there are all the professionals around, the doctors and the nurses and so forth, but there's also that other aspect, which is community. The people whom I meet here are just so interesting. They're not just all professionals. They're people like the people back home in Guilford. And it's like a great big neighborhood in a way. But this place is unique. Wherever I have a choice, it would be my choice.
One way that the community comes out to help is with Fair Day, where people donate items for White Elephant and auction and bake pies, and it's a wonderful day, the first Saturday in August every year.
It's really an amazing community event. It was a wonderful thing to see the old folks talking to each other and watching the kids play in the pond. The auctions going on in one tent, where a lot of people have furnished their children's college dorm rooms, you know, but it is a totally communal event.
Grace Cottage Hospital has always been superb at managing the unknown, and we're able to work one-on-one to wrap a safety net around each and every patient, whether it's through administrative or medical or our community health team. Everyone works together to make sure that the best possible outcome for the patient is being achieved.
I just feel this is the right way, shape, and form that medicine should be provided. It just feels right to me. It just feels that what I do in the clinic integrates with what I do inpatient, with my colleagues in the emergency room, with my outpatient and rehab. It's just a true health center, and it's the kind of setting I want to be in.